veterans living with chronic pain remain skeptical about the VA's plans to taper them off their pain medications. Good evening, I'm Sarah Diamond.
I'm Josh Smith. It's part of a national shift away from opioids at VA medical centers. In response to Nate Morbido's initial report, veterans reached out to him wanting to know specifically what research VA officials were citing that supports the change.
Here it is. The VA is giving this 2015 study by BMJ, formerly the British Medical Journal, a lot of weight. Researchers looked at 2,400 American veterans prescribed opioid painkillers who died from overdoses. The study found the higher the dosage of opioids, the greater the risk, especially with veterans who also take anti-anxiety medication.
You want to see the whole tattoo?
Mike Nielsen's tattoos tell the story of his job as an Army Ranger.
Airborne air assault.
His scars
It's my shoulder.
tell the story of the injuries he suffered while serving.
Fell out of a helicopter in a training episode.
Injuries that are still painful today.
Back and shoulder and my hands. It feels like I don't even feel the tips of my fingers anymore.
But what he says hurts the most
And this is what I have left. Can you see it?
is the fact that the same VA that started giving him hydrocodone to treat his chronic pain years ago
From 2009 till just recently.
is now taking it away.
The past 3 months, they started reducing it, and now I get a cream. They're not the one feeling the pain that we are.
Dude, I get it. It's very challenging.
Dr. Martin Eason admits he's never lived with chronic pain, but he says that doesn't mean he can't understand veterans' feelings and make decisions that are in their best interests.
I understand their fear, their anxiety, and their anger, but I want them to understand that this is driven by our concern for their safety.
The VA Opiate Safety Initiative chairman says this research supports those concerns. New guidelines by the Centers for Disease Control also warn about the dangers. As a result, the VA is reducing the amount of opioids it prescribes, tapering veterans off of the painkiller, especially people who take high doses, those who are also on anti-anxiety medications, and veterans with other health issues, factors Dr. Eason says can contribute to overdoses and other complications. He says opioids have more long-term risks than benefits.
But it's one of those things where you go, you know what? You can hate me, but I can get up in the morning and feel like I'm doing the right thing by you.
Instead of opioids, the VA is now suggesting alternatives like physical therapy, acupuncture, and yoga to manage pain.
You know, it looked pretty funny with a bunch of old men laying there on the floor.
Mike Nielsen is skeptical.
I did the acupuncture, and it burned me.
In the meantime,
It's terrible.
he says you'll find him here, sitting in a chair, not nearly as active as he was just a few months ago.
Now, without having that medicine, I'm limited, very limited.
Nate, I know you've heard from a lot of veterans about this topic. Specifically, they're wishing that the VA would look at their individual situations before tapering them off, and specifically wanting to know whether they actually abused drugs, right?
Right, kind of looking at their history. And Dr. Eason says they are using a case-by-case approach at the VA. And he also acknowledged that every patient is different and said there are some cases where a low dosage of this kind of painkiller could be beneficial.
All right, Nate, thanks for the follow-up tonight. The president of the American Academy of Pain Medicine told us there should not be any hard and fast rule when it comes to the prescribing of opioids, telling us all patients are not the same. You can see what else he said on WJHL.com.